All right, the best is yet to come. Our next speaker is going to give us some information that I have been looking forward to, perhaps as much as any talk here. Thor Ole Gulsrud is a project manager of Pumps and Pipes Norway. It's an organization, it's our cousin organization in Norway. It has its objectives of bringing together innovation, bringing together the various science and industries in Norway, and encouraging students. And as a director, emeritus director of Pumps and Pipes here in Houston, I am a bit envious because Pumps and Pipes Norway, in my view, is how you do pumps and pipes. So further ado, let's hear about progress in Norway from Thor Ole. Thank you.
Thank you. 1 year ago, I had the pleasure of presenting Pumps and Pipes, or Norway Pumps and Pipes for the first time in Houston. So this year, I'm going to give you some updates of what we have been achieved the last year, some of the activities that have been running. So Norway Pumps and Pipes, the inspiration comes from, of course, from Pumps and Pipes in Houston. We have an cooperation agreement with Pumps and Pipes in Houston. And in the beginning of 2016, we received funding from the Ministry of Health and Care Services. So we were very lucky. It was related, of course, to the bad times in the oil and gas industry. So in the region where I come from, Stavanger, we were hit very hard. So this was also an opportunity to sort of move into other areas than oil and gas. So this picture in the middle here shows the Minister of Health and Care Services and also the Mayor of Stavanger. And this was the start of Norway Pumps and Pipes. This funding made it possible to establish this project in February last year. So you see we have almost the same logo as you have here in Houston. We missed the space. Maybe it's coming, I don't know. So Norway Pumps and Pipes, like here, it's an arena for bringing people from the academia, the public sector, and business together. And the research partners are the University Hospital in Stavanger, the University of Stavanger, and the IRIS, it's a research institute in Stavanger. And we also have a group of companies, partners, as you see to the right there. It's not that many companies. It doesn't seem to be a big cluster, but some of these logos there are a collection of many companies, like Norway Health Tech, are more than 200 companies within medtech, and also Norwegian Smart Care Cluster. It's also a collection of more than 100 companies within welfare technology and medtech. So altogether, it's quite a big collection of companies that are in the sort of working group for the Pumps and Pipes project. So one of the main activities that we have been running for the last year is to be an arena for, as I said, for academia and business. So we have arranged a lot of seminars, lunch seminars. It's a free seminar, it's a free lunch. We serve pizza and soda, and it has been very successful. It's been a good arena to bring together professionals from different sectors, oil and gas and medicine. And professionals have come to these arenas and present both challenges, but also research from projects that are running. And we also have arranged information meetings where we are giving information about possible funding programs from the Research Council of Norway or other programs. So that it's something that we will continue in the years to come to be a platform for bringing people together from different sectors. And also, Next year, I will say a few words more about that later on. We will arrange a conference in Norway with the same model as here in Houston. So I mentioned that we got funding from the government, and some of that funding we have spent on initiating projects. So we have funded so far 8 projects, not much money per project, 200,000 Norwegian kroner. I don't know the currency right now, but $1 is about 8 Norwegian kroner. So, but the main thing here is that by funding the project, we are sort of initiating cooperation. So it's a start to start working together. And we have achieved a lot of publication or attention. Here is a government white paper describing these 8 projects, and also this one says, it's in Norwegian, but they said in 1 year they found 8 examples on how oil technology can solve problems within the health sector. And this is a report from Norwegian Oil and Gas presenting 26 projects that are examples of projects where you have transfer of technology from oil and gas to medicine, and 5 of those projects are from the Norway Pumps and Pipes. So we are very proud of this attention that we have received. So this shows how we like to run Norway Pumps and Pipes. This is a workshop at the university in Stavanger. A cardiologist, he present a challenge to the audience, and the audience are professionals from oil and gas and medicine. And the question is, can somebody in the audience calculate how much a given stenosis affects the supply of oxygen to the heart? And after this presentation, he was approached by a petroleum researcher, and this was the beginning of a Norway Pumps and Pipes project. They got funding from Norway Pumps and Pipes, and now they also have applied for more funding from the Research Council in Norway. So the name of the project is Non-Invasive Assessment of the Coronary Arteries based on data modeling and medical imaging. So this just to illustrate the idea of this project. So in the middle, you have the traditional way to assess stenosis. The new project, or the proposed method, is to combine CT image of the heart, like you see here, and segment the image, and then you run a simulation model from reservoir. So this is a good example of how to use methods from petroleum, in this case reservoir modeling, into to medicine. This is just an example of simulation that we have run using this model from reservoir. On the left is a simulation of blood flow velocity, and to the right is a simulation of blood pressure. So by instead of using this invasive method, you can calculate what we call the flow fractional reserve, the number that gives information about the severity of the stenosis, without having to do this invasive procedure. This is another example. This is also applying a flow model from reservoir to try to get a better understanding of how cancer are spread in the body, not only looking into the biomolecular processes, but also taking into account the physical forces that are involved in the spreading of cancer. So this is just an illustration. This is a drop of oil in viscous water, where you look at the surface tension. If you have a strong surface tension, the drop is contained like this, and if you have a weaker surface tension, the oil drop will start to spread out. So this parallel can be applied to study how a cluster of cancer cells behave if you have a strong surface tension or if you have a weaker surface tension. So again, using models from oil and gas to medicine to obtain more insights into the problem, to the challenge. So one good thing about this is that if you, instead of only looking into the biological analysis, instead you combine the more traditional way to assess or to study the spread of cancer, medical imaging. And by using this combined different approaches, you are able to achieve a more personalized treatment. So these two projects, stenosis evaluation and personalized cancer treatment by looking into the physical forces, are example of crossover projects, are very heavily research projects. So this is a long-term project, but it also gives us an opportunity to build up a strong research group within data modeling and medical imaging. This one is a project that are in the other end of the tier, the technical readiness level scale. So this shows a picture of 4 young former students that has now established a company with support from Norway Pumps and Pipes. What they have been working on is to develop a rotational module that can be placed under any mattress, so that you can not rotate, but you can move patients that are not able to move themselves. So the main purpose here is to avoid that the patients are developing bed sores. So bed sores is a very big challenge. Of course, it's painful for the patients, but it's also a big challenge for healthcare workers that have to do manual lifting of the patients. And manual lifting are the main cause of back injuries and sick leave in the healthcare sectors. So they started as students. They are now full-time employees in this company. They have received 1 million Norwegian kroner from the Research Council of Norway to further develop this mattress. And now they also want to make it smarter, meaning that they want to put more sensors in the mattress that makes the mattress more personalized, taking into account the weight of the patient and also measuring temperature and what do you have. So they won a World Cup within health tech for students some months ago. So this is a really good project for Pumps and Pipes. And you can ask, where is the Pumps and Pipes in this? Well, these students, they didn't know anything about pressure control. So they went to the oil and gas industry, to a company there, and they get help to develop this rotational model, which steering this mattress. This is a new project started just some months ago, and this is for paramedic. It's a new equipment for removing fluid from the patient's airways. So, as I said, for cardiac arrest, every second counts. And the equipment today is not that much used, at least not in Norway. And the reason for that is that you have some points there, it's too big. It's also manually, it's not effective. And also it's clumsy to operate because you have to place this tube inside, and you also have to build up vacuum to be able to make this traditional equipment work. So they are now in the process of developing a new tool that is always ready. You have vacuum as you turn it on. It's a one-hand operation. You can control it with one finger. It's designed for rough transportation, and also it's important that you can rotate it as you like. The traditional equipment you have to place in a vertical because otherwise the fluid will move in the wrong directions within this equipment. So it's also easy to use. It's you replace this canister after use. It's made of environmental friendly material, so you don't harm you don't make waste that's harmful to the environment, and it's battery operated. So they have received funding from Pumps and Pipes to make this prototype. And the challenge, this shows this is not the way it will look when it's finished, but this just to illustrate the concept here. They have to make sure that the fluid is kept in this canister and it's not going back into the patient or into this part of the device. So they are seeking help from petroleum researchers to look into solutions on how to make sure that this fluid is kept in the canister. They look into mechanical approaches or also into chemical approaches. So this is also a startup company. They are 2 employees in the company to develop this device. I mentioned earlier that we are planning a conference in Stavanger next year in Norway. It will be in October. So if you haven't been to Norway, this is a good opportunity. It's a beautiful venue. It's at the beach outside Norway. It's in October, so it's not possible to go into the water that you can't do in the summer anyway. But it's a nice place. And if you have been to Norway and want to go back, this is also a good opportunity. So I welcome you all in Norway next year. And that was all. Okay.